Myself is a mixture between European countries. I was born in Belgium, I trained in Belgium, I got my medical degree in Belgium, I started my radiation oncology practice or training in Belgium. Then I moved to the Netherlands at the Netherlands Cancer Institute for a 1-year fellowship, which turns to be a year and a half. Then from there, I moved to Houston, Texas, where I trained for 2 years. I came back to Brussels, where I became the leader of the head and neck team, head and neck oncology team. And then 4 years ago, something like 4 years ago, I was asked to come over to Lyon to become the head of the Léon Bérard Cancer Center, Radiation Oncology Cancer Center, Léon Bérard, not the full cancer center. So we are the third largest cancer center in France, and we are we are the third largest radiation oncology department in France, with some specificity, stereotactic treatment, children radiation oncology, so pediatric radiation oncology. And of course, within this specific environment, we were thinking about, and we are still thinking about, moving into proton therapy. And then when I thought about it, I said, proton therapy, expensive, maybe we should treat patients upright or seated. Then I was connected via the chairman of the board of Leo Cancer Care to the CEO of Leo Cancer Care, Stephen Toh. And then we started discussing and then collaborating, and then obviously putting some new projects together and new ideas together. And of course, from protons, I slightly moved, without forgetting protons, of course, I slightly moved into the photon radiation oncology. And that's where we are today, with behind me, I guess I can say, the first ever built chair to seat or to position patient in the seated or upright position. When I was thinking myself, I said, yes, why are we always lying down the patients and looking at them from eye up? No, maybe we could just simply ask the patient, would you mind sitting or standing upright? Are you still comfortable? And then we could see the patient eye to eye or face to face. That would bring a totally different relationship between patients on one side and the doctors or the radiographers or whoever wants to talk to patients while he or she is being treated. It has been a fantastic experience for 2 reasons. Number one, it's a challenge to try to reinvent or redefine, maybe is a better word, redefine the way we treat cancer patients. That's a challenge, and as an academic radiation oncologist, challenges are part of my daily life. Second, it's always extremely, and I mean it, extremely pleasant. When you speak to the CEO of a company, you can take your phone or you can write an email and you directly get to him. It's not with 20 different layers, secretary or whatever, and we can exchange, and all the discussion I've been with all the people I've met at Leo Cancer Care have been extremely productive and fruitful for me to understand the need and to understand the challenges, and maybe for them to understand what do they have to provide to the medical community. And that's why it has been an extremely rewarding travel or journey together with Leo Cancer Care. So what we have been doing regarding the partnership is that we have the chair, you have the chair, we have the chair behind us, and we are still doing the validation of which position, which immobilization system we would need. The next step will be to have the vertical CT. Hopefully by midsummer, we could have the vertical CT. This will be the next step to really show what we can achieve in terms of organ positioning, dose distribution, and then hopefully the next step will be to have the beam. And so we'll have the 3 components, the seat, the CT, and the beam.
I am a radiation therapist and I have been working in Léon Bérard Center for 14 years. After passing a university degree in research, I obtained national grants for 2 protocols which are currently in progress. These researches concern patient positioning for radiation therapy and IGRT. In 2020, Professor Vincent Gregoire, head of radiotherapy department in Léon Bérard Centre, gave me the opportunity to work on the Leo cancer care technology. I accept this challenge. After presentation of the device and first reflections about how to lead this research, the journey has started in March 2021 with a Leo cancer care team came for the chair installation. They offered me training about the chair and the optical system software. The Leo cancer care teams are very reactive and they are always looking forward to receive feedbacks from volunteers and from users. We are working together in order to gather and share all the ideas and all points of view to improve the device and to imagine the future of radiotherapy. So the main part of the research concerns pelvis positioning. The position for pelvis localization is almost complete with a result of repositioning and immobilization accuracy based on optical images completely similar to the results in the literature for patients treated in supine position. The volunteers' feedback are very good, with a preference for the upright position for the majority of them. They reported to be more comfortable, especially on the back, and it's really easier to find the position again and to get out of the device. The chair rotation is not a problem, especially because the rotation is gradual and not too fast. I have also carried out some tests for head and neck cancer setup requiring a suitable backrest. I have planned to lead the research about breast cancer patients in the context of Master in Research that I am studying currently. Finally, a clinical trial to compare dose distribution and more specifically doses to organ at risk is expected and in progress of regulation validation.